The sling procedure can help with incontinence after treatment for prostate cancer. The incontinence sling procedure is an operation for men who have incontinence that have failed conservative measures. That means they have not responded to Kegel exercises, diet, weight loss, and medications. A sling procedure is performed by making an incision underneath the scrotum and placing tissue, lifting up the urethra, putting pressure underneath it to help add increased resistance so that urine does not leak when a man is up moving around. Typically, this is an outpatient procedure, but sometimes we will keep a man overnight afterwards. Occasionally, we'll keep a catheter in for a short term after the surgery. The decision for which surgery to have for incontinence requires a long discussion with your doctor. Whether you've had a radical prostatectomy, radiation, or other treatments for your prostate cancer will determine and make a difference in what you choose. Oftentimes, there are more complications in men that have had radiation, whereas in men that have had radical prostatectomy without radiation can choose any one of the treatments and have reasonable success. The decision which surgical treatment to have for incontinence will be determined partially by what treatment you had for your prostate cancer. Prior TURP, prior radiation, radical prostatectomy, and other procedures will make a large difference in what the outcome will be. Men who have had bladder neck contractures or scar tissue are going to be limited in what their options are. In any case, you should have this discussion with your doctor to decide which of the options are best for you.
Some prostate cancers are high risk, aggressive, and more likely to spread. Others are low risk, least likely to have bad outcomes. The biopsy says cancer, but current diagnostic tools provide limited information about how aggressive a man's individual disease is. So most men decide to treat prostate cancer immediately. Once treated, many men experience serious long-term side effects, like incontinence and sexual impotence. Immediate treatment isn't always needed, but right now a man can't be sure if his cancer is the kind that is likely to require treatment or if he's okay to wait for now. What if there was a test that could determine how aggressive prostate cancer is? Genomic Health is developing a new test to do just that. By reviewing the underlying biology of the tumor and using genes from multiple biologic pathways, the test can predict the aggressiveness of prostate cancer when diagnosed, allowing a man to make a more informed treatment decision with confidence, taking care of himself with more information and greater peace of mind.